Hey there! When we talk about antidepressants, it can often feel like the conversation begins and ends with SSRIs. Well, today we're going to change that. We are opening up the entire medication toolkit to look at the other powerful, specialized options out there for treating depression.
So that brings up a really big question, doesn't it? If drugs like Prozac and Zoloft are the most common first step, why on earth are there so many alternatives? It's a fantastic question, and the answer gets right to the heart of what modern mental health care is all about.
And the answer is, well, it's actually pretty simple. Depression just isn't a one-size-fits-all problem. It shows up so differently from person to person. For one person, it might be crippling anxiety. For another, it's this bone-deep fatigue or chronic pain, or just not being able to sleep. So you can't have just one tool for the job. You need a whole toolkit. Okay, let's pull our first set of tools out of that kit. We're starting with the SNRIs. You can think of these as the versatile multi-tools, the ones that are really good at tackling two big problems at once: low mood and, very often, physical pain. So, SNRI stands for Serotonin-Norepinephrine Reuptake Inhibitor. I know, it's a mouthful, but the most important part is right there in the name. While SSRIs focus only on serotonin, these medications boost two of the brain's key chemical messengers, serotonin and norepinephrine, and that gives them that special dual action. So how does that dual action actually play out? Well, boosting serotonin does what you'd expect. It helps improve mood and cut down on anxiety. But that norepinephrine boost, that's the real game changer. It can help with energy, and really importantly, it helps the brain manage how it processes pain signals. But there's a critical heads up for anyone taking these. You can't just stop. You have to work with a doctor to slowly taper off to avoid some really unpleasant withdrawal symptoms, sometimes called brain zaps.
A perfect example of this is duloxetine, which you might know by the brand name Cymbalta. Just look at its uses. It's not just for depression. It's for fibromyalgia, chronic pain. This is that dual benefit in action. But the heads up here is absolutely vital. Because there's a risk to the liver, regular monitoring of liver function is a must.
And what's really interesting is that even within the same class, there are differences. Take Venlafaxine, or Effexor. At lower doses, it pretty much acts just like an SSRI, working on serotonin. But as you can see, it's only when you get to those higher doses that the norepinephrine action really kicks in. It's a perfect illustration of how nuanced these medications are and why they need to be managed carefully by a professional.
All right, so SNRIs are for mood and pain. But what if the depression feels more like a total lack of energy, motivation, and focus? For that kind of problem, we have to reach for a different tool in our kit, the NDRIs.
NDRI stands for Norepinephrine-Dopamine Reuptake Inhibitor, and the first thing you should notice is what's missing from that name: serotonin. This class of medication leaves serotonin completely alone. Instead, it targets norepinephrine, which helps with energy and alertness, and dopamine, which is so central to our sense of motivation, reward, and pleasure.
And the main player in this category is Bupropion, brand name Wellbutrin. You'll see it used for depression, seasonal affective disorder, even for smoking cessation, and it all comes back to that stimulating dopamine-boosting effect. Now, a huge benefit for many people is that it has a very low risk of the sexual side effects that are so common with other antidepressants. But, and this is non-negotiable, the heads up is serious. It's absolutely contraindicated, meaning it must never be used in people with a history of seizures or certain eating disorders.
And we are giving this its own slide because it is just that important. The risk of seizures with bupropion is the #1 safety concern. The risk goes up as the dose goes up, which is exactly why the dosage has to be managed so carefully and why those contraindications are taken so seriously.
So let's just put these two side by side for a second. This makes the difference crystal clear. On one side, you have SNRIs, working on serotonin and norepinephrine, great for depression that comes with pain or anxiety. On the other side, you have NDRIs, working on norepinephrine and dopamine, a much better fit for depression that feels more like fatigue and low motivation. And because their mechanisms are so different, their side effect profiles are too.
Okay, now for our final category. Let's call these the specialists. These are the tools you bring in for very specific jobs that other antidepressants might not handle well, especially when it comes to severe insomnia.
First up is the SARI class. That full name, Serotonin Antagonist and Reuptake Inhibitor, is a real mouthful. Honestly, you don't need to remember it. All you really need to know is that this complex action on serotonin has one very common and very powerful effect. It makes you sleepy. The classic example here is Trazodone, and this is a fascinating case study in how a drug is actually used versus what it was approved for.
While it's officially an antidepressant, it's almost exclusively prescribed at lower doses as a non-addictive sleep aid. The heads up here is for a rare but very serious side effect called priapism, which all male patients need to be educated about.
Our other specialist is mirtazapine, or Remeron. It has a totally unique mechanism that ends up boosting both serotonin and norepinephrine. It's often a go-to choice for patients who have depression along with severe insomnia and a really poor appetite. Now here's a weird quirk. It's actually more sedating at lower doses, and the big trade-off to be aware of? It's well known for causing a significant increase in appetite and weight gain. So we've gone through SNRIs, NDRIs, and these unique specialists. The big question now is, how does a clinician actually choose the right tool from the kit? Well, it all comes back to a personalized approach.
And this really sums it all up perfectly. You don't just treat depression as a single diagnosis. The goal is to target the patient's specific cluster of symptoms. Is the biggest problem also chronic pain? An SNRI might be the best fit? Is it that debilitating fatigue? An NDRI is a logical place to start. Is the lack of sleep making everything 1,000 times worse? Then you'd look at a specialist like Trazodone or mirtazapine.
And this, right here, is the most important point of all. Effective mental health care is about moving beyond a one-size-fits-all model. The whole goal is to use this diverse toolkit to address the specific, unique way depression shows up in an individual and to improve their overall quality of life, not just to score on a piece of paper. So this leaves us with a really fascinating question for the future. As our understanding of the brain, of genetics, gets deeper and deeper, what are the next tools in this toolkit going to look like? Will they be even more targeted, even more personalized, and even more effective? It's a really hopeful vision for where mental health treatment is headed. Thanks for tuning in.